Good evening, everyone. My name is Solange Zie. Thank you for joining me. I am the project lead for uh, the Project Portal Enhancement Initiative at UC Davis Medical Center. Today, I will introduce the goal, scope, and expected impact of Patient Portal project and explain how this work will improve patient access, engagement, and uh, and care coordination across our service. This slide gives a quick friendly overview of what the project will cover, from identifying the main problem and reviewing our data and survey feedback, to examining workflow issues and applying the SDLC steps. It also highlights the improvement I plan to make, how I would test them, communicate with stakeholders, and the performance measures to use to track progress overall. It sets the stage for how this enhancement will strengthen patients' engagement and improve care coordination. Um, Problem statement slide. Uh, li- limit Limited patient portal engagement disrupt workflow efficiency and led the poorer patient outcome, while improving accessibility and usability fosters better communication and support patients centered care. It also who are those affected into this project? Um, it also it is also important to recognize that this issue extends beyond a single department. When delay occurs, they affect all teams that rely on timely occurrence information to keep their work moving. A slowdown in one area often triggers a chain reaction that disrupts communication, follow-up process, and overall coordination across the organization. As Harian mentioned, even small workflow efficiencies can create system-wide ripple effect that impact both staff performance and patient outcome. Impact of the problem. By making the patient's portal easier to use and improving how information flows between patient and providers, we help the organization deliver care that's safer, more efficient, truly centered around the patient. The updates also help patients stay more involved in their health, reduce delay, and make communication smoother for everyone. In the end, it supports our staff, led to better patient experience and outcome. Um, Justification for projects. I want to emphasize the business need for this project and the quality improvement it brings. Our organizations need solution that stimulate our organization needs solution that stimulate reduce errors, save time. Save time. These are real business priorities. At, at the same time, this project directly improve patient care by making processes smarter, increasing engagement, and supporting better outcome. In short, it addresses both operational efficiency and the quality of care we provide. Baseline data requirement. So I have a matrix that requires a baseline. Before the matrix, so I have the message turnaround time, portal usage analysis, appointment complication matrix, login issue frequency, and survey responses patient staff. For this project, I'm bringing together experts from different areas to make it work, such as IT analyst that handles the technical side, clinical informatics, and patient experience team ensure the portal is effective and user-friendly, and care navigators, and providers give real-world clinical insight. Workflow redesign specialist hub, streamline process for staff and patients by working together. Uh, this multi disciplinary team makes sure the project is practical, efficient, and truly improve patient care. Project scope. Um, I use this slide to keep the scope focused on deliverables that are realistic and truly achievable. Project scope out of scope. So clarifying our boundaries is really important for keeping this project realistic and doable. When everyone knows what is in scope and isn't, it helps us stay focused, avoid unnecessary obstructions, and make decisions that support the project instead of slowing down. It's simply about protecting our time, our goals, and the quality of work we are trying to deliver. High level deliverable. Reinforcing expert outcome. Oh, sorry. Mhm. For this project, I'm using the SDL because it keeps everything organized and patient focused. I start by understanding the real workflow issue, then analyze what I need to change. After that, I designed the improved system and build it based on this. I test it with real users to make sure it works well, then roll it out with training and support. Even after it's live, I continue checking in and improving it. DLC helps me stay clear, consistent, and aligned with better patient care. And which is the system life is a planning, analysis, design, implementation, testing, and evaluation. For this project, I use the DSL because it also keeps the work organized and focused on real user needed. In the planning and analysis phases, I identify the workflow issues and gather staff and patient requirements, which is exactly what the SDLC emphasis is. So it talks on planning, identifying portal challenge, analysis, which evaluates survey, design, which creates workflow, UI improvement, implementation, deploy small scale, testing and user acceptance, evaluation and monitoring. Patient survey result. So I did a patient survey result. From my analysis, I found some clear themes, navigation messages, and how easy it is to log in. The insight really shaped my recommendation, like making menus simpler, messages clearer, and login smoother, so I can make the portal easier and make satisfying for patients. From this chart, we can see why some staff ratings vary. When we looked deeper, the same issues keep coming up, navigating fault confusion, and the login process slowed down. These two themes show again and again, helping us understand where the real pain points are. This survey result shows that most staff rated the workflow impact around a 3 or 4, meaning they felt the same real improvement. A few gave even higher score, which is great, and a couple score lower, reminding us there is still room to adjust. Overall, it gives us a clear picture of what's working and where we can keep improving. Testing ensure reliability, safety, usability improvement, which is my testing plan here. So you use user acceptance testing, patient or staff group, document of issues, bug tracking and mitigation, restarting after adjustment. On this other slide, I'm going to talk on communication plan. So communication keep all teams aligned and aware of progress. Performance measures. The key KPIs focus on real impact, faster navigation, higher login success rate, quicker message response times, and improve overall user satisfaction. This indicator shows whether the challenge truly make a portal easier to use or more supportive for both patients and staff. I just want to share that in our result, don't land exactly where we expect. I am ready to adjust. I will work at what the data is telling us, listen to some users, and make the changes needed to get project back on track. The goal is to stay flexible and keep improving so we deliver something that truly works for everyone. As I wrap up with this project, I feel confident and fully prepared to present the finding and recommendation to leadership. This work aligned clearly uh, with organizational goals, the SDLC guide, each step structured and purpose, and the improvement directly support better workflow efficiency and patients experience. I am ready to move forward, answer questions, and show how this enhancement can make a meaningful impact across our system. Thank you very much, and I am ready to answer questions. Here is our finalized reference list per APA 7 edition formatting. Thank you.